Okay, welcome back. So what we were talking about, the first segment of the show was a lot about allergies, and there's a couple things I also wanted to mention that you might be able to do in your home that might be able to help you, and that is reduce some of the dust collecting areas in your body, and not in your body, but in your home, such as ceiling fans and things of that nature, reducing shelving, and certainly stuffed animals. Those things can promote a lot of dust mites and a lot of other things that could be allergy producing. Changing your filters can be very helpful, and some of the air purifiers can also be very helpful in ionizing and holding on to some of those things. So those are a few things you might want to look at in your home. Okay, so about 3 or 4, maybe 5 TV shows that we did a little discussion on high blood pressure, and I kind of dropped it because I wanted to get on this rant about the pharmaceutical industry and the DEA, and so I kind of dropped the high blood pressure issue, but I want to bring up a slide and I want to talk a little bit about treatment of high blood pressure. I know I'm kind of changing gears on you here, but one of the things that's the most important thing about treatment of high blood pressure is changing your lifestyle. And basically, it means a better lifestyle. So what that is doing those things that we know cause high blood pressure and trying to do those things that we know can alleviate high blood pressure. Obviously, a sedentary lifestyle is very bad for you. The more you sit, the more you gain weight, the more you reduce your heart disease and things of that nature. In fact, I read an interesting comment today which said that if you have an exercise pattern and you lose it and you decrease your exercise over a period of 6 years, you basically have a twofold increased mortality due to all causes. So regular exercise could potentially reduce your mortality, let's look at it the back way, by as much as 50% by getting some regular exercise. So getting off the couch, not watching TV is very important for general promoting circulation. And one of the things I have on my wrist are these things that are kind of interesting. This is a Garmin version of a lot of the Fitbits and things of that nature. I like it because it actually can track your steps and can track what you're doing, and every once in a while it'll come up there and say move, meaning I haven't moved enough. And I find that my weight and things of that will change with how I actually walk and how much activity I actually do. I set a goal of 7,500 steps a day, and of course I don't even do that in the office, and you think you do, but you have a real idea of what you really do when you put one of these things on there. It actually also tells you how you sleep. It tells you how much you move when you're sleeping. And there are cheaper versions out there. This one was a little pricey, a little over $100 and some odd dollars, but that being said, these are nice, and a lot of people have Fitbits, and they have that. This one actually connects to my phone, and I can do different things with it, and I like that particular model. But it's very good feedback for you to see how well you're doing during the day with your activity. I can walk a half a mile or maybe a mile or two, and that's about 2,000 steps. So that's a lot of calories being burned, and so there's only so much you can limit your food intake. To take it to the next level, you really do need to increase your activity. So that's one of the major things you can do. The other thing you can do if you've been diagnosed with high blood pressure is to limit the type of salty foods. So salt does hold on to water, and so the risk is for those people that reduce the salt in their diet is that they tend to splurge every once in a while, or they'll eat out, and all of a sudden they will swell up like a balloon because they've been on a very low salt diet. So understand that when you do take in a salt load, your kidneys take about 3 days to excrete that salt load. So you will notice some swelling after you've eaten out, especially when you're not used to. And your blood pressure will be higher for those days as part of the volume distribution, meaning now you have salt in your system, your kidneys have to excrete it, but it's going to hold on to the water in the meantime. So that's very important to keep in mind. Alcohol. Very potent. It dilates your blood vessels on your skin. but after 2 drinks, you're going to get 2 ounces of alcohol, you're going to get high blood pressure, and it's going to stimulate your heart, and it's going to work against you. So that's why 1 ounce of alcohol or 2 beers is probably the limit of what you should be doing a day if you like it on a day. And if you can't control that limit, then you might have an issue and you might need to seek treatment for that. That being said, smoking is obviously one of those things you want to eliminate because smoking is a very important vasoconstrictor. One of the things I tell patients is not to check your blood pressure after you eat or within an hour of having a cigarette, because your blood pressure is going to be extremely elevated. So if we can go back to the list, we'll talk about some of the other medications. Diuretics have been out for ever. And probably the major diuretic on the market that people talk about are the hydrochlorothiazide diuretics. And when I first started coming into medicine back in the 80s, that they were using high doses like 50 milligrams. Since then, they basically have gotten down to it being a combination drug with an add-on to a lot of products and using about 6 or 12 milligrams. Obviously, that is changing. If you have congestive heart failure or you have a kidney issue or some other problem, you will use higher doses and stronger diuretics. But for the most part, uncomplicated hypertension, meaning not associated with congestive heart failure or some kind of kidney disorder, what they call iatrogenic low-dose diuretics are one of those products which are still cheap and are still very effective. Then come the calcium channel blockers. These are drugs that are two-type, the dihydropyridine group and the non-dihydropyridine group. That would be nifedipine, would be the dihydropyridine group, the first one that came out. It does dilate blood vessels, but it also causes a reflex and tachycardia, meaning if you dilate your blood vessels, your heart rate usually picks up. So those are one of those things that they tend to move away from today. Calcium channel blockers are useful products, but they're probably, I would say, more useful for prevention of migraines than they are in that. But that being said, one of the products is very good, which is the non-dihydro, which is diltiazem. It tends to control heart rate, very useful for people with COPD, because the next drug on the list is beta blockers, and beta blockers are very bad for people that have asthma or they have COPD. The reason being is that in your lungs you have beta agonists. These keep your lungs open. So if you take albuterol or ProAir or one of those things of that nature, Xopenex, you're using a beta agonist to keep your lungs open. And one of the things you have to try and stay away from, if possible, but sometimes it's not possible, is the beta blockers. The best beta blocker for a COPD is a bistolic product, which is more selective, and that's the one I would tend to use in people that have COPD. There are probably some other cheaper ones out there. Coreg, not, it's kind of wishy-washy, so, that's something that can work with your cardiologist to make sure that he understands that you may have a lung condition if he's looking at controlling your heart rate. It used to be if you had an MI, you automatically got put on a beta blocker afterwards, and I still think that's true for a lot of people. So be careful if you're on one of those and you have a lung condition and you smoked for numerous years. The A blocker is alpha blockers. There are two types. There are peripheral alpha blockers and central alpha blockers. The central alpha blockers are drugs like clonidine. They're very, very effective, very potent, blood pressure lowers. They tend to cause dry mouth, a lot of fatigue, but they're very useful. I give this in the office when someone comes in the office with an elevated blood pressure. It usually lowers their blood pressure within 20 to 30 minutes, but it has a rebound phenomenon also. And then some of the newer drugs, the ACE inhibitors, which are lisinopril, those drugs have been on the market again for a long time. One of the major side effects I see with that is this chronic, dry, non-productive cough. If you're on a drug like lisinopril, benazepril, or one of those particular products, and you've got a dry, non-productive cough, your healthcare provider needs to know about that so that he can hopefully switch you to the next product, which is an AR2 blocker, which is basically an angiotensin receptor blocker. And I'll probably go into more details about the mechanisms of these particular products, but suffice to say, I would much rather be on an AR blocker than an ACE inhibitor, mainly because there are escape mechanisms from the ACE. The AR2 blockers don't really care about that. They're a very clean product. They can have a little side effect with cough, but it's very, very rare. I've seen it 1 out of maybe thousands of patients. And then some of the newer products are the direct Renin inhibitors, which are an offshoot of the ACE inhibitors and the AR2 blockers. It actually inhibits Renin, which is a protein made by the kidneys, which has this thing for high blood pressure. So those probably make up 95% of all the products that are out there for high blood pressure. Each one has its benefit, each one has its downside. The rule of thumb is usually one product for every 10 millimeters of mercury over 130 if you're young. If you tend to be over the age of 50 to 65, those blood pressure standards have been reset up into the 140, 150, and higher if you are a little bit older. So we've run out of time tonight, and again, thank you for tuning in. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and I hope to see you here again on Monday night next week. Thank you for tuning in tonight.